Welcome to Edgeview. In today's video, we are going to discuss about IQN New Zealand online theory exam and OSCE, how to success. Also, what should be done and what should be avoided, and how can be able to succeed in the exam. So, please watch. Now we can see New Zealand IQN online theory exam. This exam contains actually part A and part B. Part A, like it has 10 to 12 questions and medication calculation, cultural safety and everything. But in the part B, it's typically based on the clinical knowledge. It's like medical, surgical, pediatrics, maternity, mental health, and emergency response. Mostly that like the part and the questions based on the scenario. So they are giving like a scenario, might be it is like too long. Nowadays it's updated and it is too long. So it will take time to read. But please read one, twice, thrice. It's like more than what you can. And then respond to the questions accordingly. Like might be in four multiple choice questions. It has like two similar one and like same like in OET or IELTS. So please eliminate like what you can and to decide like what should be the answer. So please go through that one. In that you need a proper preparation and do the sample materials as much as you can. In this part B, they are mostly checking like how your nursing knowledge and the skills is merging, and mainly are you practicing or are you applying based on the cultural safety practices in New Zealand. So we need to learn accordingly. So we can see like how to study for the online theory exam. So you can go through it's like in part A, you have to understand the Treaty of Waitangi and Code of Conduct, Health and Disability Code, Privacy Act and Informed Consent, and also the practice, delegation, accountability, cultural humility, and especially when working with Maori and Pacific populations. Also the medication calculation, you have to know like what's the equations and what the formula should be used. Mainly the questions are coming like mg to gram and also like how the solution should be and how the medication calculation might be the infusion rates and one or two simple question and you can expect like one complex questions as well. So prepare well. And in the part B, applying nursing theory to scenarios. Study common conditions like cardiac, respiratory, renal, diabetes, infection, mental health, and learn prioritization. What to see first or what to study first, you have to think. And know common emergency responses like fall, seizures, chest pain. If like this condition comes, how you will be respond. Being a New Zealand nurse, you have to New Zealand registered nurse, you have to think like that. And understand medications indications, side effects, calculation, and safe administration. And also practice scenario based MCQs and like we have our own materials. If someone interested, we can share the details. That is like very excellent and good materials. So you can go through if you're interested. Also, you have to practice whatever the questions and from wherever you get. But the thing should be aligned with the New Zealand IQN or New Zealand nursing practice. And like case-based decisions, rationals for each answer. So you have to learn the rational, then only you can, like whatever the questions come, you can think the rational and able to do the correct answer. And also, time yourself under exam conditions. Also, how to reduce failure rate in the theory exam, specifically Part B. Focus more on New Zealand specific law and ethics, prioritization and safety scenarios, communication and documentation, cultural safety and respectful care. Need to avoid memorizing without understanding, ignoring Maori health context or values, and skipping practical exams. These things should be avoided. Then, so if you are practicing well and learn with rational and align with the New Zealand practices, cultural delegation, and the scope, there is a chance to success and not the chance. 100% you will be. like you can tackle the exam. Next, we are going to discuss OSCE. And OSCE, the overview is like, like 10 stations, and performance time is like 8 minutes, 2 minutes for preparation, 8 minutes for the performance time, and another 2 minutes for the transition period. So in that, common station should be like mental health, vitals, physiological, specific physiological, CPR, wound care, medication administration, and the communication scenarios. But before starting, I wanted to say like, think like you are new to the situations and listen their concern, be empathetic, and follow the aseptic technique, follow the cultural practices, and try to give the solution. Even though you know the format or you familiar with the conditions, please don't think that, don't be preoccupied. You have to listen the patients and according to them need to prioritize the care or the performance what you have to. Then the success chance is more. So you need to practice. That means like you have to practice with role play, specifically like individual role plays, and also the simulator practice that will make you feel confident. But even though it's like you are confident, think like you are going to attend the exam. Like when you are like studying, you are attending a lot of practical exam. Before the practical exams, we all did the mock test. But we know like the mock test, something we learn, like we are familiarizing with everything. And the real exam, we are approaching like a new. So whatever the questions come, we won't like, we don't feel like unfamiliar. We will do it like that. New to the station. Prepare well, practice with role play, familiarize with the equipments, but you are a nurse, you have the clinical skills, and use your clinical judgment, and you have to know about what is New Zealand, what is New Zealand nurses doing, and how to practice, then do it. There is a chance to success, not the chance. I wanted to say like it's like 100%. Also, you need to focus for what is being evaluated. Like clinical skills, in that they are checking like accurate performance of steps, wound dressing, BP measurement, CPR, and everything. And the communication, empathy, clarity, patient education, and reassurance. You need to reassure the patients. You have to give them a real solutions and rationale. And the cultural safety, respect for Maori beliefs, family involvement, pronouncing names correctly, because here you have to pronounce the names correctly. And if you don't know the name or if you forget, just ask them like, how can I call you or how can I address you? You can tell them. And also don't forget to greet the patient and introduce yourself and get informed consent. That is the main thing. You should not be like, you should do that, and it should not be missed that. Then documentation, clear, legible, legal, accurate, and relevant progress notes. We do not want like a long notes, but make it relevant. Professionalism, dress code, hygiene, and explaining what you are doing. Right to be informed. You have to explain like whatever the things you do and get the consent. And confidentiality, completing task within 8 minutes without rushing or skipping. You don't think like you need to finish in the 8 minutes, but we know time frame is needed, like the time frame and the time management should be. But don't be rush or don't be hurry. You just try to finish or you just try to listen their concern and do the solution. Or in the clinical skill station, perform well. How to practice OSCE? The first one, role play with a partner, simulate full minute stations, and swap roles. Be a nurse, patient, and the examiner. Mirror practice is very important. And also, like if someone there to do the role play, please do it. And that will help for the simulation practice as well. Then use cue cards with expected tasks and vital signs charts. Be familiar with the New Zealand EWS. And one of our video explaining that one, please watch that. Then checklist. Make the checklist for insulin injection, blood pressure, and wound assessment. Then you can examine, you can assess what you are performing and what should be done. And you have to be familiar with the pain score and the mental health assessment and how to support the patients. And please study or please learn how the New Zealand culture is or how the New Zealand cultural practice. Then documentation is very important. Write full progress notes like in the SOAP model, but like short form, because if you are elaborating, we will not get the time. But whatever the things you are writing, it should be legible and clear and relevant. And handing over should be in ISBAR format. And like any vitals or any intervention or anything you are feeling like to be escalated, please write in the notes, because some of the stations do not have, like, they do not have the documentation time, but give importance to communication. Then communication also, I wanted to say, like, you have to practice with the ISBAR model, because we need to hand over to the doctor, might be charge nurse, but you have to learn accordingly. And I wanted to say, like, what they look for in OSCE and what the common mistakes should avoid. The mistake is like skipping hand hygiene. What to do instead? Always sanitize hands before and after interaction. That will make you like to do frequently. Also, please familiar with hand hygiene moments. And talking too fast or too little. Speak clearly, pause, ask questions. Then ignoring emotional cues. Please avoid that. Use therapeutic communication. You seem upset. What do you like to talk? You can talk to them or be empathetic. I'm so sorry. You can say to them. And rushing without explaining. That should not be done. And the other thing is like poor communication, poor documentation. Write legibly, like include the relevant contents, and don't forget to date, time, and signature. IQN online theory exam sample materials are available, updated version specifically designed for Part B, and also the OSCE online and offline role plays. Individually, we are giving good attention and getting good success rate. And if anyone interested, please don't hesitate to contact. Thank you.